Okay. Okay, Kathy, you're live.
Good evening. I'm Kathy Fletcher. I'm the CEO of Voices for Children of San Antonio. And on behalf of our partner and sponsor of this event this evening, West Care, I want to welcome you to this very important event. This is not our usual kind of event. We typically are talking about early childhood, but this is very important to early childhood, to teachers, to parents, to everyone in the community. We wanted to bring you information that would help get all of us through a very new and somewhat confusing time. The past year has brought an awful lot of pain and suffering and loss and just disorientation. Everything's been different. We now have a chance to really begin to get out of it. But like with anything new, the vaccine is scary. Something going into your body is scary, and it's still pretty new. We wanted to bring you experts to talk about it, but not just experts, people who I think many of you know have a long history in this community of being able to be trusted, who work in the community, who care about the community. So that's very important. I think most of us, I know I have had the vaccine, and I'm here. So anyway, it is my pleasure to introduce one of our good friends and Bear County commissioners. Following, we will go right on from there. I don't want to take a whole lot of time going back and forth, but we will right at the end of this. But it's my honor to introduce County Commissioner for Precinct 4, Tommy Calvert.
Thank you very much, Kathy. It's truly an honor to give introductory comments before this great panel of folks who have literally been saving lives, people who I want to hold up and herald. Thank you for your vision in doing this to a very special audience, which is all of the teachers that are impacted through the Voices for Children program. And I'm no stranger to this group. Many of you already know my story. I'm a former preschool teacher, taught in inner city Boston, 3, 4, 5-year-olds through the Jumpstart program. And because you all are around children and families, it's very important that we have a heart-to-heart about vaccine hesitancy. I am a person who had vaccine hesitancy, but I'm proud to say that I have had the vaccine and I'm doing fine. I like to make a little joke that I haven't grown a third eye or any other problems. I want you to know my father has had the vaccine. In fact, he had the Johnson & Johnson vaccine. My mother, Dr. Val Calvert Grant, my stepfather, Reverend Hector Grant, have all had the vaccine and everybody's doing fine. We're fortunate we didn't even have any side effects, just the sore arm. And so I just wanted to give you my testimony about why it's important that we unmask things together. First of all, unmasking is about unmasking the issues of, well, rumors, all kinds of things that are said, what we may read on the internet. And we're going to get into a panel that knows a lot about that. You're going to hear from doctors, nurses, and other community health professionals. But unmasking is also about getting the vaccine so that we can take our mask off as a society. But only about 51% of adults currently have the vaccine. And sometimes Texans are a little bit more restrained in what we do in that regard. We have fought for access for vaccine centers all across Bexar County. I want to make a special mention of where we normally have our Voices for Children training, St. Philip's College. If you've been there before, it is a vaccine center. And anytime from 8 to 4, you can go there without an appointment and get a vaccine, people of any age. Of course, if you're working and you need to go after hours, the University Health System has our vaccine center at Crossroads 5 to 8. You can go there without an appointment as well. So I just want to encourage everybody to do a little homework. Now, vaccine hesitancy and unmasking, has happened for a variety of reasons. Some of the folks on this panel know I was one of those folks who said early on, before the vaccine was developed, I'm not taking it. And one of the reasons I said that was because of concern over who was president, just to be perfectly honest, and whether or not there was going to be any racism with respect to it. I know that's a prevailing wind in a lot of folks who are African American because of the Tuskegee experiment, because of what was done to Native Americans. But I think one of the differences to point out in what we're trying to do today is that, first of all, the scientific community, the medical community really took the lead on this. It wasn't politicians, thank goodness. And so it has been vetted by the FDA. The vaccine has been vetted by the FDA and the CDC, and it is safe. Our president, our vice president, Kamala Harris, have all taken the vaccine and are doing phenomenally well and didn't have any issues. And so, I just want you all to know that I'm here today because you are special. You are special to our children. And as teachers, it's incumbent upon us to look at science, to work with science, believe in science, to study, do our homework, just like we would want to tell the kids we teach. We got to do our homework. I did my homework with my doctor. I have medical conditions like a very low white blood cell count, where I was very concerned about, whether or not I could have side effects or my body could handle it. I encourage you to talk to your doctor. I made it through just fine. So whether you have health concerns, whether you have concerns about the speed in which the vaccine has been taken, now millions, tens of millions of people, not only in the United States, but around the world, have safely taken the vaccine. So I will let the experts really get into more details, but I'm grateful to encourage you tonight to do the right thing for your country, your community, and your family. And I got to tell you, I really feel at ease. I used to be a person who traveled for my job almost every month. I had no problem staying off of a plane. But after my vaccine that I received in March, I was able to get back on a plane again for the first time. And just the peace of mind to be protected. I've been through COVID-19. I got it in January. It is no fun. I was fortunate, really fortunate for a lot of reasons. But we can't play roulette with this, and we can't let doubt and fear be the energy that governs our lives. We've got to move in with love. And this is about loving our neighbor, because when you protect yourself, you do protect that senior who may not have gotten that vaccination yet. And you do protect that child who may not have gotten that vaccine yet. So I hope you'll keep on loving yourself and loving your family and community and the kids you serve. Thanks for having me, Kathy.
Thank you for being here, Commissioner. We really appreciate it. And now we will turn this over to our moderator, Francine Prosser Johnson, who is CEO of the South Texas Center for Pediatric Care. Francine.
Good evening. It is certainly my pleasure to be here with all of you this evening. And thank you, Commissioner Calvert, for all of the things that you shared with our community about the vaccine and all of those things that you can say about it that are truly from the heart. and from your experiences. At this time, I would like to introduce Dr. Tommy Austin, who is here with us this evening. And Dr. Austin, we are excited to have you. I'm glad to be on a panel with you again. Dr. Austin is the Senior Vice President and Chief Nurse Executive for University Health Systems. Welcome, Dr. Austin.
Thank you. Good to see you again.
Good to see you. And I'd also like to introduce Dr. Diana Burns-Banks, who is President of South Texas Center for Pediatric Care, a longtime pediatrician here in San Antonio. Welcome, Dr. Burns. So I'd like to start off with a few questions, and my first question is to Dr. Burns. And one of the primary concerns, one of the things that consistently comes up is the question about how safe is the vaccine. So this will be something that both Dr. Austin and Dr. Burns can answer. And so I'll start with you, Dr. Austin.
Good evening, everyone, and thanks for the opportunity to speak to Voices for Children. And the vaccine is very safe. It's been tested through the Institutional Review Board for the organizations that have developed the vaccine. So Pfizer has their review board, Moderna has a review board, and Johnson & Johnson has a review board. And what they do is they test it on different individuals, and that's how they find out what side effects occur and what dosage should be allotted to each individual. So in my opinion, the vaccine is very safe. I've taken both doses of my vaccine. I took the Pfizer, and I got a little sick after the Pfizer vaccine, after the second dose, but it's nothing like getting COVID. And I've not had COVID, and I don't want it.
No, I can't get on. I can't get those.
We were having some technical difficulties. Dr. Burns, can you hear me now?
Yes, I can hear you. It's
okay.
It's always scary when the sound goes away and I cannot find the sound. Okay, I'm back here now. I'm ready to go.
So our question that Dr. Austin had just answered was in reference to the safety of the vaccine and so many people's concern about its safety.
Yes, and I want to echo what Dr. Austin had said. The vaccine is very, very safe. Anything that's new always carries can carry some issues, but this has been looked at by the CDC and the FDA, and it has been tested in thousands of people. And the thing that's most reassuring for us is that we know that it is continually being monitored now, because we know the thing that came up with J&J, the Johnson's vaccine, it sounds like very few, because it was 6 people in millions, 6 million people. So it's a very few numbers, but they're still monitoring to see if there's any negative side effects. So it is as we know, the standard side effects that we've talked about as far as headache, fatigue, a little bit of fever, chills, and those things are common. We don't know of any long-term, it is new, so we'll be looking at and talking about long-term effects, but we know at this point it's a safe vaccine and we are reassured as a country and as a people, because we know that they continue to monitor it for safety. And just as a pediatrician, just to know all vaccines are like this. We continue to monitor our vaccines, and mumps, measles, and rubella has been around for at least 30, 40 years. And we continue to monitor. Anytime I have a child that has a side effect that is different, we send it in to a vaccine reporting service. So even though those vaccines have been here for years, we continue to monitor those. And I think that assures us that they stay safe, and that any side effects are always monitored.
Okay, thank you, Dr. Burns. Those are some really reassuring thoughts and facts that were given by Dr. Austin and by Dr. Burns. Now, I also would like, we have a very unique opportunity. We have someone that has joined us, Miss Barbara Silva. And Miss Silva has the opportunity to share from a very personal perspective about the COVID-19 vaccine and what type of effect and impact that the vaccine had on her personally and her family. So thank you so much, Ms. Silva, for joining us, and we look forward to hearing your story.
Thank you. It's a pleasure to be on this panel with so many distinguished individuals. So thank you very much for including me. My family did contract COVID last year, back in July, and we did lose my mother, and we're very close to losing my husband due to COVID. So we had some concerns about the vaccine when it initially came out, but my husband was so close to death, and the idea of trying to go through that again was certainly concerning for us. My mother did pass away, and we have my father-in-law and my mother-in-law who still remain with us. We have taken good care of them to make sure that they were protected and isolated from all of us for a number of months. When the vaccine came out, we did do some research, and we did get them both on the list after quite a bit of trying. All of our family members were on the phone trying to get appointments for them. We finally were able to get them scheduled, and my father-in-law had no side effects at all. My mother-in-law had no side effects after the first Pfizer vaccine, but for the second vaccine, she was ill for probably a good week. She had chills, and she had a low-grade fever and a lot of body aches. So she was a little uncomfortable, but after that week, she's been fine. We've been able to see her and hug her again. So it's been nice. This past Easter was the first time that we were able to get together with them in, gosh, probably over a year. My family, I have my husband and I have 3 children. Both of my daughters and my husband and myself were able to obtain the Pfizer vaccine. Again, no side effects for us. My husband did have probably 2 days of side effects after both vaccines, but the rest of us did fairly well. My son is 13, and he is not able to get vaccinated at this time. And that was another reason why we opted as a family to go ahead and get vaccinated. When someone makes a decision like that, it's primarily for the people around you that could really be in a life-threatening situation, or for my son, who's not really able to obtain a vaccine for still a few more years. So I'm here to tell you that COVID was certainly very difficult, life-changing event to go through. And if you have the option to get vaccinated, I tell you that it's probably the best decision we've made. Thank you.
Ms. Silva, thank you so much for sharing that. That's your testimony, your story, and as we can hear, it's very real in terms of how it impacted your family and all of those that are close to you. My condolences for the loss of your mother, and thank you for being so open and honest with us about what transpired, which allows us to segue to a question about the side effects and how the vaccine can have long-term effects on individuals. And so, Dr. Burns, can you address that for us?
Okay, I too want to appreciate Ms. Silva for actually sharing, because I think that is the way we get other people to realize that COVID it is a real illness and does have real impact on real people's lives. So we really appreciate you being able to tell them and tell them that the side effects by no way, the immediate side effects by no way are nearly as bad as some of the long-term side effects of COVID. Now, when we talk, I think Ms. Silva did a really neat job of telling you what the short-term side effects with the fever, the soreness, the achiness, those usually last 2 or 3 days. So up to a week is a little bit longer, but they are very common and they resolve without any real significance. We are a little bit more at a loss at what are some of the long-term side effects of this illness, because it is so new. But we do know people who've had it have one big thing they're talk about, their brains being foggy. They can't remember as well as they can. They'll have long-term problems with headache and cough and those kind of things. There is some research looking at some of the potential long-term effects, and that is some things that might affect the brain, that this might be a predisposition to having some strokes and stuff. If you have the disease long-term, there probably may be some damage to your lungs is a possibility, because it might do some damage to the little air sacs, and that at the end of the day, as you get older, that might cause some scarring of your lungs and lead to some long-term term side effects. So, and the last, there possibly some effects on your heart. We've heard some people, some of the athletes who talked about having some heart conditions that kept them from playing. So as we go through this illness, like every illness that we find, there is the possibility of having some long-term effects. And that, again, is a real reason why we need to get the vaccine. Because if the vaccine prevents the illness, and we will not be worrying about the long-term side effects, but because the long-term side effects, the illness, it was acute now, but some of those side effects potential as we look down the road 20 or 30 years later in your life that you could have. We're talking about some problems, maybe even some predisposition for Alzheimer's or Parkinson's disease in the brain because of the idea of it having the little small microclots. So it is an adventure that we're yet to live on what are the very, very long-term side effects of it.
Francine, I know I'm not on the panel, but I would like to just back up what Dr. Burns just said about long-term COVID, if I could, because it is an important thing to consider. A lot of the discussion that has happened out in the media and online is that, if I get COVID, I'm just going to get through like a flu. It will come and go. One of the things that I can tell you from personal, and let me also say, Ms. Silva, thank you for sharing your family's experience, and I'm very, very sorry for your loss. One of the things that even I still struggle with is sometimes a little bit of nasal congestion. That was one of I didn't have major symptoms. I had fairly minor symptoms, but I have found that long-term, there are times where I'm having nasal congestion, and I'm working pretty successfully at weaning myself from different nasal sprays when it gets bad, and using nutrition and different changes in even diet to find a healthy way. But the long-term COVID effects are something I think everybody really needs to hone in on in terms of why you should take the vaccine, because from my perspective, almost immediately within 6 months, I began to think about, how are we going to deal with long-term rehab? I heard from senior citizens who used to walk 2 and 3 miles a day who could no longer do that, and they would need to have rehab. I heard from folks who, as the doctor said, had heart issues, lung issues, other kinds of long-term issues, which may end up affecting your ability to work and provide for your family. So I want you to think about that very seriously in terms of you're getting a vaccine and preventing you from having what I now have. I have a long-term COVID situation that I am dealing with, and I'm doing well. But if you haven't gotten the vaccine and you've been on the fence, I would encourage you to do so. One of the other long-term COVID things that we have found is that according to the Kidney Foundation, 46% of the people who have been hospitalized wind up with a form of kidney disease. afterwards. So the kidney is also affected with COVID. So these are long-term COVID. I want to thank Dr. Burns-Banks for voting with the University Health System to increase our hospital capacity going forward. We're excited about what may come in Selma. And it's important that the whole infrastructure of healthcare think about your long-term, but you individually, in providing for your family, can prevent your inability to work by getting the vaccine. So I just wanted to say that. Thank you.
And I'd like to add something, because a lot of times we think youth protects us. And youth in this case does not protect us, because the one thing about time, we all will get older. So that's the danger with this, because we don't know the idea of the micro clots that it makes, which a clot kind of obstructs the blood flow to a certain area. That's why you're talking about areas, organs like your kidneys, your heart, and your brain. And long term, we know about the issues with dialysis, and we also know about the issues that we see in our society now about Alzheimer's and Parkinson's. And you would not even at 19 want to do anything that might predispose you to get Alzheimer's at 60. So getting a vaccine, 10 seconds of an injection and maybe 48 hours of some discomfort will not even compare to long-term of years of disability. So it is definite a real reason to start to think, to consider, and to get which vaccine you can get. Mm-hmm.
So thank Okay, can you hear me? So I said, thank you, Commissioner Calvert. You're absolutely a part of the panel, and we appreciate your input at this time. And absolutely from the perspective of the long-term effects, and even about the historical conversation about the testing and about the actual minority population and its concerns about the vaccine and how it was created. I know, Dr. Austin, on a couple of other panels that we've been on, there's been conversation in particularly about the research of the vaccine and how Black and brown population was involved or engaged with that research. Were they engaged in that research? And a little bit about that, if you would, Dr.
Yeah,
Austin.
so when Pfizer and Moderna and Johnson & Johnson did their experimental, they made sure that they had populations that reflected our communities. So yes, African Americans, Hispanics, and other minority groups were included in the research group. And so what's great about that is, again, we know that they all went through investigational review board, and like Dr. Burns said, they all went through the FDA. And they had to be tested. And that's why it's so important that if you have a side effect that is not the side effect that we've been talking about, and that you report it. And I just want to add to the long haulers, because I have a couple of coworkers, and they cannot smell or taste still. And they've had COVID maybe 6 or 7 months ago. So it's, for me, getting the vaccine was a no-brainer, because I did not want to have any COVID side effects. And I have a girlfriend in Austin. She had COVID in December, and she's still having complication, which they call long hauler syndrome. And you just don't want it. And so if you can prevent that, why not take the vaccine?
So with that said, Dr. Austin, we hear about people that say, I think I want to wait. I just want to wait and see what else is going to change or what else is going to be happening. I want to wait. What is your thought process? What is your advice to share about those people that talk about they just want to wait? That's
some of my relatives. Well, what I tell them is, one, you can't visit me unless you get your vaccine. So for me, I think waiting is a personal choice. However, if you wait, you have the bigger risk of contracting COVID-19, because we have strains that come about that we don't have any control of. We have a strain from South Africa, we have a strain from the UK, we have a strain from Brazil. And so what the vaccine does, it prevents you from getting as sick as you would if you didn't have it at all. So for me, it's very important that we educate our family and friends about not waiting, but go ahead and getting the vaccine, because one of the things we want to do is create herd immunity. So I have a cousin with cerebral palsy. She is not able to protect herself and she hasn't taken the vaccine, but everybody around her has taken the vaccine. So that's why it's so important. Protect, like County Commissioner said, protect the ones who cannot protect themselves. And you can do that by getting the vaccine yourself. And there's no reason to wait. Like you said, at Wonderland, you can get the vaccine from 5 to 8 without an appointment. And you can go to St. Philip's College and get it all day long from 8 to 4.
Thank you so much, Dr. Austin. Dr. Burns, could you expound upon herd immunity and share with the listening and viewing audience a little bit about what herd immunity is and what that means?
Certainly, we hear a lot in the news about, oh, we want to get to a point of herd immunity. We will never get to herd immunity unless you get the vaccines. It is two ways that we could say you get to herd immunity. One is having the disease, and the other is having the vaccine. The preferable way is to have the vaccine. The definition of herd immunity is simply that so many people have had the disease or had the vaccine that we no longer have the virus in our community. That number varies on how contagious the virus is. It started off with COVID with them saying when 60 to 70% of the people are vaccinated, we'd have herd immunity. That has changed some because we've got all of the new strains coming in. So it's not really a definite number. I can look at for mumps, measles, rubella, and I'm familiar with children's vaccines. It is 95% of people had to have that vaccine before we called it herd immunity. So we are talking about getting enough people vaccinated so that we don't have the virus running free and can mutate in our community. And that's probably going to be at least probably in the 80-90% of the people being vaccinated. So the key to us getting back to a normal environment, a normal lifestyle, is herd immunity. And herd immunity is vaccination. So those people who say they want to wait, I'm always curious to what is your point that you're waiting for? What is the factor that will say, oh, now it's time to get the shot? I'm not, because waiting at this point just endangers all of us. It keeps, if you're not vaccinated, the strains that come out that can be more contagious are out there. So our key is to get herd immunity. To get herd immunity means you got to get vaccinated.
Okay, well, thank you. And with that said, Dr. Burns, and you being a pediatrician, I know there's been a lot of conversation in the news and a lot of question about children and vaccines. Can you share with us a little bit about next steps and when children under the age of 16, what that will look like for our community?
Yeah, we know that the vaccine has been tested into children, the Pfizer in children up to 16. They are running tests in children. Pfizer's doing children 12 to 15, and Moderna's children's 12 to 17. That they are testing the vaccine in now. I think that is important. We realize that for children particularly, pediatricians are very hesitant about new things. So it will have to be the safety will have to be established. And a lot of times we're thinking that children, you hear in the news, children are getting mild diseases, they aren't really affected. But actually, I looked up some statistics. There have been over 13,000 children hospitalized with COVID, and there have been over 250 kids to die with COVID. I always say those numbers don't sound really astronomical, but if that one child is yours, that is 100%. So I really think that it is not a bad disease in children. If children don't have significant disease, don't play a whole role in these numbers, but they do play a role in these numbers. So it's very important that we start to look at getting these kids vaccine. I think they're also looking at kids 6 months to 11 years old. And this would correlate with the way we give the flu shot. The flu shot itself starts at 6 months now. So we have some history. So it's not something something new. 6 months olds have always been getting a flu shot, and the flu is a virus, and so it's COVID-19 is a virus. So the idea of trying to get children vaccinated, I'm not sure if it's going to be something that has to happen before they can go back to school. I'm not really, I'm a proponent. I'm very much a proponent of getting kids back in school, because the socialization and the learning process that has been severely affected by the COVID-19. But research is being done, and children, and it is being tested in children now to see the effectiveness. And it's not just effectiveness with children. You got to figure out the right dose, because every adult gets the same amount, but children get a different amount of virus injected, not a virus of the vaccine, based on age and sometimes on weight. So they have to figure out dose and age related doses for the children. But it's exciting. So it's still, again, no reason for that adult not to get that vaccine, because that by the adult getting that vaccine, if you're 16 years or above, you again protect that child. And we know that child, those 268 kids who died, their parents think that's 100%. So we need to get that vaccine.
Thank you, Dr. Burns. And that was exactly what I was thinking for all of us here that are part of this listening audience, the hundreds and hundreds of people that are sitting tonight in front of your computer, in front of your iPad, your phone, or whatever. We have the opportunity to protect and impact the children. When we talk about voices for children, we can be that voice, because we have the opportunity to do the right thing and get the vaccine. And so that allows me to segue, Dr. Austin, to the unborn child, about pregnancy and the vaccine. And if you can share a little bit with us about that. So much has been said, myths and, fears and about pregnancy and the vaccine. So can you talk with us a little bit about the pregnant mother and how that impacts them?
Well, I think at first the CDC had some hesitancy in regards to vaccinating pregnant women. However, we had pregnant women who were getting sick with COVID-19, and their symptoms and side effects are so bad from the COVID-19, and they rethought that. And so we have been encouraging pregnant women to get the COVID-19 vaccine. And with a pregnancy, you do have the opportunity to give the baby some immunity. So Dr. Burns can tell you better about that, because that's her field. But it's important that we vaccinate pregnant women. They can get sick from COVID-19. And we've had several in our facility that have been really, really ill from COVID-19. And so it's very important. The vaccine is not going to mutate your child or turn it into an alien or anything like that. It will take care of you, and it will take care of your child, so that you don't have to worry about that as you bring in this new life.
And I just want to echo that with pregnancy and you get the vaccine, you build antibodies, and those antibodies cross the placenta, and that's what helps protect the baby. So again, that vaccine is important, very important. So you're protecting that unborn life. So cannot emphasize enough getting the vaccine.
Thank you, Dr. Austin and Dr. Burns. As we prepare to bring our questioning to a close, one of the questions, since we are having so many people that are into their second shot, what is the advice? What is the conversation about individuals that have had their second shot, and should they still need to wear a mask? Dr. Austin?
Yes. The reason I've had both my shots, I had one in December and one in January, and I still wear the mask because of the strains that are out there. And I don't know how those strains will impact me in regards to the Pfizer vaccine. So in order for me to continue to protect myself and to protect others, I wear a mask. And so we encourage all of the individuals in our organization to wear a mask. And I have educated and encouraged all my family members and friends to wear a mask, and they continue to wear a mask. When they come to my house, you have to wear a mask, regardless if you've had the vaccination or not. So it's important that we help prevent illness and death to our family and friends. I cannot stress that enough. Prevention, because I would feel really, really bad if I were the one who was spreading COVID-19 to a family member and they passed away. And I have a 99-year-old cousin, and I will not visit her without having a mask on, even though I've had both of my vaccines. So it is important that we think about others rather than just ourselves.
Thank you so much, Dr. Austin. Dr. Burns?
Oh, I agree. I think at this point we need to continue to wear the mask. If we want to not wear a mask, let everybody get our vaccination so that we can be all protected and we can prevent the spread of possibly mutating the virus, so that we will have a virus that is not covered by the vaccine. So wearing a mask is a little price to pay for another couple months to get back to normal and to protect those that we love that cannot be vaccinated. So let's be real, people. That's not much. You're putting on a mask. So it's not bad. So we need to do it for another couple months, as we've been advised. And I know people say, why get a vaccine if you're gonna still have to wear a mask? It is not much longer. So you got it when we can say 100% of the people or 90% of the people have a vaccine, we will say it's really no need to wear a mask. So it's coming. It's coming, but we need the people out there who actually are having the doubts, the people who are concerned whether they're going to be another Tuskegee experiment, because they're not. They're not going to be there, whether they're going to turn into aliens or grow 3 eyes or something if they got the vaccine. You are not. But if you get COVID, you do have the possibility of ending up in a hospital on a ventilator, and you have a real possibility of death. And if you don't, you have a real possibility of long-term side effects, part of which, no matter how young you are or how old you are at this point, we do not know. So it is better to get the vaccine at this point and not have to worry about the rest of those things.
Thank you so much, Dr. Burns. Thank you, Dr. Austin. I think that you have provided a plethora of information to our listening audience to give them some assurances and some insurance about what needs to happen and what we all can do to be that very loud voice for the children of San Antonio and this community. So any other closing remarks that either of you have as it relates to the vaccine or to our children here in San Antonio, and to the teachers that are on the call tonight that are so important to our next step of getting back to some sense of normalcy?
I will just be happy when they get it to the 13-year-old, because my little traveling buddy is my nephew and he's 13 and he is ready to go somewhere, and he needs to go back to school because he is not doing well with online. So that's why it's so important. Get vaccinated. All teachers get vaccinated. Co-workers get vaccinated. Please get vaccinated. I cannot beg you enough. Get vaccinated.
And I guess
Hey, I have one comment quickly. One that my daughter calls me regularly. Now he's back in school finally in New Mexico last week, has called me virtually every day saying, I'm going crazy. He has to go back to school. So, I mean, it's really very, very important. The other thing that a number of folks that we work with have asked, because they work with a lot of young mothers, is the possibility of fertility problems if you get the vaccine. Could somebody comment on that?
Dr. Burns, you want to comment? I mean, I've heard Dr. Ramsey give talks on it, and he's an
Obstetrician.
Dr. Burns, that's her specialty. You're muted.
Actually, I have that is one of those, I guess, things that I have no idea where that would have come from. It's not anything that's in the data that they're even looking for. It is not anything they're talking about. It's not any side effect they would have researched. The vaccine has been started in December. Pregnancies, you generally go about 9 months, we hope. So I know they're not looking at at anything. So some things that we come up with as potential side effects are probably told by somebody that would not have privilege to that kind of information. That has not been something that has been told. Vaccines are I don't even know even when we talk about long-term side effects of COVID, that is not one of the long-term side effects of even getting the infection. And getting a vaccine is kind of like getting an artificial infection. So it's not really. So I think if you're interested in, if you're a young woman and you're talking about fertility, getting the COVID vaccine is probably one of the ways that will provide you to have an opportunity to be fertile and to have a child. Not getting the vaccine and coming down with COVID as a disease is probably a lot more likely that you would be detrimental to your possibility of fertility. But no, I would advise any young woman that that would not be one of the considerations that you would take in as far as affecting your fertility.
Thank you.
Thank you, Dr. Burns. And again, thank you, Dr. Austin, for your powerful voice in this community and for the opportunity to share all of those messages and answer the questions that have been at the forefront of so many individuals' minds about the COVID-19 vaccine. So thank you very much. At this time, I would like to introduce someone that is a familiar face to all of us, and that is Mr. Ray Saldana. Mr. Saldana is the president and CEO of Communities of Schools, and he's the former District 4 City Councilman. So let me say welcome to you this evening, and please take the mic.
Thank you so much, Ms. Johnson, and just to Voices for Children for having inviting me to come and be part of this important conversation. I feel just so thrilled that I get to sit in and listen to Dr. Burns and Dr. Austin in such an accessible way, explain a lot of the common questions that many of us in San Antonio, whether it's with family or friends, are confronting without all of the expert knowledge that was just given to us. And in some cases, we'll read an article or we'll see a news story. And for the guests today to really just distill it down to the most simple explanation really gets us to a point where we can feel a sense of confidence with our neighbors and friends. To be here with Kathy Fletcher and the folks from Voices for Children just reminds me of my work in San Antonio, reminds me of our work with our early childhood instructors and coordinators who are training this next generation of young people and wondering what to make of this moment that we are living through and the kind of effect that it's going to have on the young people that we are supporting and we are raising. And it's just an honor to get to speak now with a different hat. I now get to lead an organization that is in 26 states all across the country. We're serving in 2,900 schools. So we have been really tracking how superintendents, principals, and teachers are grappling with this crisis. And it's important to connect it with why it's so incredibly important for you to make the individual decision and then be an advocate amongst your family to get vaccinated. And here's my simple pitch. So at Communities in Schools, we have about 3,500 trained site coordinators who are working in schools. These are the Army, the troops on the ground who are interacting with students who have dealt with what a school closure has felt like and has been experienced. And our site coordinators work with students, whether it's basic needs like food, housing security, access to healthcare, access to family and parents around stimulus checks that may be going in. We're doing a lot of the navigating for families because school is such a hub of social services for our young people and their families. And so regardless of this bigger question that I want to get into around lost learning, that if we continue in this experiment, if we prolong the period at which we are keeping teachers and principals and educators to interact face-to-face with students, we know what the effect is going to be because we know history, and we know that history tells us who is disproportionately impacted by this experiment around hybrid and virtual learning. Not only is it that we're getting, we're hearing from parents and families like, let's get these kids out of the home. Here's what the research has told us. And folks over at Deloitte and the team of researchers have given us the most forefront information on just the measurement between school closures from March to May of last year and what that equated to in terms of not just lost learning, but unfinished learning. So assuming that you are in the best case scenario and you are perhaps a family of means, they really dissected the difference between a white student who lost about 4 to 6 months of learning in just that snapshot between March and May, not including the summer, not including the beginnings of the school year in the last. That was 4 to 6 months for white students. For Black and brown students, it started as early as 6 months to 12 months of lost learning. Not to mention that when you are, considering the lottery of life and the community that you were born into and the family you're born into and the circumstance you're born into, it often can feel like we are carrying weights to just really get through the system. If we play things well, there's always these biases, these implicit policies that are impacting our young students. And then there's this experiment of shutting down schools completely. And so the pitch for us is what gets us back into in-person learning, because we know, and it doesn't take a ton of research to figure this out, and it doesn't take a large survey sample of teachers and principals to discuss this, which that know that bringing students back into school is perhaps the best way to really begin this lost learning or to recover this lost learning. And it's going to take so much for a generation that we don't need to prolong this for much longer. And much like many of the guests that we've talked to today, we've got family members, we've got friends who have some hesitancy, but I know what it's like to represent, a part of San Antonio that oftentimes is the last in line to get access to vaccination. So we don't need to put ourselves last in line because of our attitude around vaccinations. And what we know about public education is that public education has taught us a number of things around what it looks like for how to vaccinate children. And really a positive effect in Texas is that we had educators become part of the entry point, the first to get in line after those who were over 65 or had underlying health conditions. So educators are quickly moving to it. And in other cities, whether it's in LA or Chicago or Atlanta, where we're tracking openings, they are making it a requirement that every single teacher has to be vaccinated before they open up. We're a little more lax here in Texas and in San Antonio specifically. So you're seeing hybrid options. But if we're going to get back to normal, it's going to require family and friends really taking serious the component that Dr. Burns described. To get to herd immunity, to get to normal, to get to a maskless community again, it's going to mean that not just that somebody that went through and had the virus and has recovered, but that you also know plenty more folks who have been vaccinated. I myself have been vaccinated, my wife, and I'm taking notes. Dr. Burns, who's 8 months pregnant, she also knows the science behind passing those antibodies to our God willing daughter who's born next month. And that's important for us. If you follow not just the science, or if you selfishly want to get to hug your mother and your grandmother, your abuelita, your aunts and tios, and have a big party in the backyard again, it really means that we are taking this serious. And as an educator, somebody who's watching schools all across the country, we can't do this experiment where we're closing and we're in virtual environments, because I will tell you what it's like, just with a quick statistic as we close out here. In Texas alone, we had 250,000 students that we lost. And I say that lost in quotes because they fell off the radar. They weren't showing up to virtual learning. When schools reopened, they didn't show up back to school. And again, it's this disproportionate effect. And what we did when we asked surveys of why students were not returning, oftentimes it's because we couldn't find the students, because we couldn't find the families, we couldn't find the parents who had been moved because they lost a job or they were evicted. And then even some of the high school students who could go back had already gotten jobs in that same time because parents had lost theirs. And so we know the generation who is most impacted if we cannot get back to normal faster. We know what we lose in terms of their potential. And this is on top of important barriers that we're already trying to remove for our young people. So as educators, as members of the San Antonio community, it's important that we get that shot in our arms and we guard ourselves from the longer term effects that Commissioner Calvert talked about, that our professionals talked about, that you don't want to go through that experiment and deal with the long-term impact. And we also don't want to deal with the long-term impact around public education of losing an entire generation. And it's in that way that we can't go back to knocking on doors where we have no students that we have found, or in some places where we just can't get back to those students who are reconnected or had to move. So it's in that way that I am, brought to great spirits and energy around the kind of love and the message that we are passing along here, that we are unified as one to do this together. And it's in that spirit that I'm grateful to get to be part of this communication, and part of this conversation and dialogue about how important, whether you are on the south side of the city or the east side of the city, the west side of the city, any part of this community, we're making so many tremendous strides. And as educators, we need to get back to normal, if for no other reason, because we know what works for our students, and we know who will be hurt the most if we don't.
Thank you so much, Ray. I can't say Councilman Saldana anymore, but thank you so much for being such a friend to this community. Thank you to everyone who's participated in this. Barbara Silva and Dr. Burns and Dr. Austin, Francine, thank you for moderating. Thank you to Commissioner Calvert for always being terrific. And I have to say that we are incredibly fortunate with some of our political leaders, former political leaders, that they are so caring about this community. And for us at Voices personally, that whenever we ask them to do anything, they do it. So it's really a pleasure always to see them. So we will have resources as well as this video up on our website, and my very technically proficient staff, which I am not, will give you the links. And I see Ellie, I just do what I'm told. I just, stand here, say this, whatever. Anyway, she will have that up. Feel free to share it. Anybody can see it and see all the presentations. And thank you so much again for being here. And thank you all for participating.
Thank
you,
you.
Kathy.
Thank you.
Everyone, for those of you who are still with us and watching, you can find all information regarding COVID-19 vaccine on our website. You can go to Voices, Voices for Children, or you can type into your URL bar www.voicessa.org. There is a tab on there that says COVID-19 resources, and if you click it, it's all nicely organized on one side, COVID-19 information, and the video to this presentation today is going to be on there. We're going to leave that there for you guys. So if your grandmother, mother, cousin, sister, aunt, person who lives down the street did not get to watch this tonight, you can share it. It's going to be on our Facebook page, Instagram, YouTube, website. We're going to be sharing it with West Care, who was working with us, collaborating with us on this event today. So they will have it all on all of their social media, and I believe they're also going to share it on their website. There is a sign-in sheet for anyone who does watch this event. You could possibly get a prize from Voices for Children. We got some great things like books and diaper bags and some wonderful other little nice treats for you guys. So please make sure you sign in. There is a Google form link in there. It's either in the chat or it's in the description of this video. So you can just look down in the description and it's there for you. Thank you all very much for joining us tonight, and we will see you all again soon. Thank you, everyone.
Thank you.
Thank you.